Today, we're going to examine the symptoms behind physician burnout in the U.S. healthcare system. Hello, and welcome to The On-Ramp, an ongoing series that highlights thought leadership from the Sawyer Business School in downtown Boston. My name is Francisca Beduya, and today I'll be speaking with Healthcare Administration Professor Erin Sullivan. Drawing on her research, she's going to talk about the impact of physician burnout in the U.S. healthcare system and why it's such a serious problem. Professor Sullivan, thank you so much for being here and welcome to the show.
Thank you for having me.
Of course. Now, you've co-authored or authored several papers on physician burnout, but how would you define it?
So Christina Maslach's definition of burnout is actually the most commonly used in healthcare. So I'm going to use her definition to start, and that has three components. The first is emotional exhaustion, so the sense of being drained or fatigued by your work. The second is depersonalization, so developing negative attitudes potentially towards your coworkers, or in the case of healthcare, your patients. And the third is reduced personal accomplishment. So it's the sense of feeling like you are incompetent at work or you're not making a meaningful impact. What's interesting about this definition is we've also done some research where we've asked healthcare workers about their own definition. How did they define burnout? And we've analyzed that data, and we're seeing people are defining burnout in the healthcare space beyond just these three components. And they're including both work and home matters in their definition, which gives us a sense that there's a potential that how people are perceiving their burnout goes beyond just these three components. In particular, we're finding that healthcare workers are pointing to broader systemic and contextual factors within the organization that are causing their burnout, which is leading me to think burnout is becoming a warning signal that an organization is experiencing some level of dysfunction.
What does your research suggest are the primary factors that contribute to this trend?
So in healthcare in particular, some of the primary factors that have turned up in our research include chaotic work environments, a lack of control over workload, and a lack of appreciation or feeling valued. And I think these three factors are all somewhat systemic factors pointing to things that an organization or leadership could potentially help ameliorate. And what we found during COVID in particular was individual level interventions such as yoga classes or free pizza. They don't fix burnout.
Are there particular aspects that play a significant role when it comes to burnout?
So for physicians in particular, the lack of autonomy and control over their work and patient care is definitely contributing to their levels of burnout. In addition, physicians come to work and want to have a sense of purpose and meaning in caring for patients. And if they're not feeling that, that's also going to contribute to their burnout. And finally, I would say in having conversations with physicians across the country about their experience of burnout and well-being, something that's coming up repeatedly is the increased consolidation of physician practices in the space I research, which is primary care, and those practices being consolidated into giant healthcare systems. Physicians are perceiving those types of systemic changes as contributing to their lack of autonomy and control over their work.
Of course. It didn't just begin with the pandemic, though.
No, absolutely not. We were actually working on burnout specifically in primary care prior to the pandemic. Prior to the pandemic, the data showed that if you were a primary care physician caring for patients and did everything you were supposed to do when patients were in your office in terms of preventative care, chronic care, urgent care, everything they needed in that visit, you would be at work 24 hours a day. What we have seen in primary care since the pandemic is that number has actually increased to 27.8 hours a day of work for a primary care physician. So we've seen that level of work and workload and lack of control over environment increase. But we also saw in the pandemic that other specialties were acutely experiencing burnout, including emergency room physicians and ICU physicians. So this didn't start with the pandemic. I think this got exacerbated by the pandemic. And I also think physicians and healthcare workers became more willing to talk about it.
Now, I'm sure our audience is wondering, but how does this affect patients?
So I would tell patients that you probably have a sense of when you're seeing a doctor that might be slightly too very burned out. You can almost sense it. I think one of the things that patients probably see and experience within the exam room is the time pressure doctors sometimes feel, and they might say they can only address one problem on this visit, or you have to come back to see them to address other issues. physicians are struggling to deal with the time pressure in their environment that has been created by the focus on productivity in health systems. I think at the end of the day, physicians and other healthcare workers, everyone in the health system wants to deliver empathetic care, build trust with their patients, and make sure their patients have caring therapeutic relationships. And things that get in the way of that within the system are contributing to burnout and affecting patient care.
What are some sustainable solutions or changes that could be made for doctors in the long run?
So that's a great question. And I would actually argue that's where the research needs to go. We have plenty of data at this point, knowing that burnout and well-being are a problem in health systems and that we need to work on it. And we need the funding and the ideas for rigorous studies and intervention trials so that we can identify solutions and scale them. I think some of what we know right now is that there is a lack of personal connection within healthcare that has emerged post-pandemic. And I have seen interventions around peer coaching and connecting healthcare workers to each other that are starting to show some impact on the levels of burnout within healthcare systems. I think the other thing we know that is interesting to keep an eye on is the external environment in healthcare. The environment is so pressurized right now, and the pressures on healthcare systems in terms of financing, regulations, and policy is also not making it easy for physicians to do their jobs. So I think looking at that from a 30,000-foot view, as well as what's happening within the four walls of an organization, is really important in identifying solutions and then scaling them and letting others know what works.
So what's next for your research, and what are you most excited for?
Oh, so there's a lot that I'm excited about. I'm particularly excited about the potential of artificial intelligence to actually help physicians with their workload and give them more time with patients. I'm really curious to see how the incorporation of artificial intelligence technology into healthcare can give physicians more time with patients. That's one thing I'm very excited about. I'm also very excited about some data we have around physicians who hold roles that are both leadership roles and they're still clinically active. And how does burnout affect them uniquely by being in dual leader clinical roles? That also really excites me because that's a special population.
Well, that's about all the time we have for today. Professor Sullivan, thank you so much for being here.
Thanks for having me.
Of course, and thank you for joining us. We'll see you next time on The On-Ramp.